All right, this is my 2-week post-op video for my L5-S1 Spinal Fusion. I just came back from the doctor, from the surgeon, to kind of check the progress, see how everything's going, healing's going, and I address some of the concerns. I'll start off with how the second week went, starting from the last video. So the first week was pretty rough, probably the roughest, obviously because I had just had my my spine fused and cut open, so I was dealing with the pain from all that. But once I ran out of the oxy and I just started on the Tylenol, and now I'm just completely off any type of pain meds. I mean, it hurts, but it's not bad at all. It's bearable, I guess, and I'd rather deal with a little bit of pain than be on some type of medication. Um, so the second week started a little rough, kind of ending of the bloatiness and all that stuff. But once that went away, it was definitely getting better. It's not obviously not great by any means because I still need assistance from time to time, and like putting on my shoes or my socks, for example, that's still difficult. But I mean, I can get dressed myself for the most part. Uh, Went for a walk around the block, which was probably the longest I had been, and it felt great. Still residual pain from the surgery site and kind of the nerves healing, I think. And I addressed this with the doctor and the surgeon. He's like, that's kind of just normal. He's like, as long as it's not like additional pain or some of the same pain I've been dealing with the same things that caused it, which it wasn't. So far I'm hopeful. He did say I'm healing really well so far. Progress is definitely ahead of what is normally expected, I guess, during this time after 2 weeks. The incision sites they're healing great. I'll put a picture somewhere, wherever. I'll put a picture of the incision sites of what their current state is right now. It is hard in the inside, I guess. Some maybe scar tissue. He did say something about hematoma, but he's just kind of just massaged it a little bit. I could put a heat pad. But he said it'll go away. Which the side of my belly that I felt was like swollen and bloated was part of that, where there's hematoma, and he felt it, and it's definitely hard on that side as well, but it'll slowly go away. But it's been getting better, thankfully. Uh, Progress thus far is promising. I'm thankful to have had the surgery, and obviously I know it's still a long time for recovery. But I'll show you pictures of the x-rays. They're obviously it's hardware, so it's never something you want in the end. And I'm definitely taking this serious because this doesn't just affect my job the way it is now, but I'm looking at this for like the rest of my life. So I'm definitely taking the recovery portion serious. I'm not doing anything that's gonna overdo it. I'm not gonna feel like I'm better and all of a sudden start doing things that I shouldn't be doing, because in the end, again, I want the fusion to go really well, and it takes time for the bones to fuse. So I'm taking everything slow. I'm not going to overdo it, because again, in the end, I want it to heal 100%. And if I'm great to be able to go back to my job 100% and continue doing it, then awesome. If not, and I have to do a different job, so be it. I'm okay with that, as long as the long term, which is again the rest of my life, quality of life is better. So I'm not going to do something that's going to make it so that I get back to work and force myself through more pain just so I can retire from there. Then obviously something that's going to affect me for the rest of my life. So taking it slow, one day at a time, and just hoping I heal to the best that I can get, and look forward to the recovery process and getting a little bit back to leaner, because that right there is not fun. And the gut, obviously. Ready?
Yeah.
So, going for a quick walk. Did the remote start on the truck just to, I don't know, so that the driving cam / parking mode doesn't die on the truck. And it's not like I can drive her because it's stick shift, and I'd probably be overdoing it if I'm pressing the clutch and all that in. So whatever. All right, so again, doing my quick little, this midday after lunch walk. Again, I don't walk far, just well, I'm probably gonna walk to the stop sign, which is like right, where's it at? Right there. Sure, right there. So it's not far, but it's definitely better, and I'm definitely walking better now. Not to say that I'm 100%. It still hurts to get up if I lay down. I still have to log roll, roll to my side, and then the wife will kind of help me push myself up. Definitely better on the right side. On the left side, it's still bruised internally, I think. So it's definitely a pain to try to lift myself up that way. So put my socks on today, which is an accomplishment. It was still kind of painful because I try not to bend, but still want to do the basic normal functions myself. So this is normal pace. A little wobbly sometimes, instability if I step wrong, but overall feeling pretty good when I walk. And I just do this, no sharp movements. If I turn like this because I don't want to twist my body. I walk like I'm a video game person, but it works. And so that's me walking 2 weeks post-op. I think it's normal, or it's slower, but it's decent, and not really a whole lot of pain.